Let's see. Okay, we're live.
All right.
Today we have a presentation by May Freck. May is a worker at Common Ground, an organization that provides services to Oakland County and Pontiac residents. And May will explain a little bit more about the services offered by Common Ground.
Absolutely. So I'll start sharing my PowerPoint in a moment. But thank you for that introduction. My name is May Freck. I am I'm the Youth Empowerment Coordinator at Common Ground. I work at the Sanctuary Runaway and Homeless Youth Shelter over in Royal Oak, which is under the Common Ground umbrella. So today I'll be talking about our youth and family services, which are largely based out of Royal Oak, and our mental health services, which are largely based out of Pontiac. So I'm going to start sharing my presentation, and we'll just go through. And if anybody has any questions or comments or anything like that, feel free to let me know. And then I will also have throughout the presentation, and definitely at the end, I will have contact for Common Ground so that, if you're watching this later on, you can reach out, ask your questions that way as well. So let me start sharing. All right. So for anyone who's not familiar with Common Ground at all, we have been in the community since the 70s as a program provider, and in our current kind of iteration, again, with the runaway and homeless shelter under the umbrella, kind of functioning as one full agency with a lot of these different programs. We've been around since around 1998. So either way, we've been in the community for quite a long time, right? And our core purpose is helping people move from crisis to hope. I think as we go through and talk about the types of services and programs that Common Ground offers, you'll hopefully kind of see that coming through. Our core values are empowerment, collaboration, innovation, diversity, and inclusivity. The way that we always talk about it internally, that we look at things, is that we're here to walk alongside people in their journey. We are not leading them where they need to be or telling them what to do. We're simply walking alongside people. We're empowering, we're collaborating with people, and we look for innovation in our programs. And we're always kind of thinking about the diversity and inclusivity part as well. So as we go forward, again, those will kind of show through our programs and all of that. Now, I'm going to start with our youth and family services. Again, this is kind of the area that I work in. These are mainly out of Royal Oak, the Sanctuary Runaway and Homeless Youth Shelter programming. Something I want to be very clear with, though, as we go and talk about these services, is that even though we're located in Royal Oak, there are a lot of ways in which people from other parts of the county are more than able to kind of take part in these programs. And even outside of Oakland County, a lot of our youth and family services programs are open to people. So when we're talking about our youth and family services, the first four are kind of our main tenets. We provide safe and stable housing. We increase positive connections, particularly in the community. And we're seeking to improve well-being and resilience of our community and our young people. And then we're also connecting to education and employment. Finally, that fifth one, that's just a really important point. I almost always get asked about it. And for all of the youth and family services that I'm about to talk about, we do not require insurance or payment for any of them. They are all free as long as you fall under the kind of, guidelines for what those programs are. So that's just a really important point. These things are free. You don't have to have insurance. If you're underinsured, that kind of issue as well. I always get questions about that. So I just want to be very clear. Youth and family who work with our services are usually experiencing a conflict in the family. A lot of times they're experiencing a mental health challenge. They might be having trouble in school with peers, teachers, or classroom learning. Quite often they're at risk for running away or experiencing homelessness. Oftentimes that's because they're living in an unsafe environment or experiencing unhealthy, abusive, and/or neglectful relationships. Oftentimes it's a mixture of these things or one thing causing the other. Right? Maybe we have a youth who is at risk for running away because they're having a severe mental health challenge and it's causing them a lot of trouble in school, which is causing conflict in the family, right? We just kind of see that mixture of things. That would be someone who I would immediately think would probably be a good fit for our programs as we're about to talk about them. Now, I'm going to start with the Sanctuary, our basic center program. It's 21 days, 3 weeks. Something really important to point out about that is if somebody comes to the Sanctuary and 2 days in, they're like, this is not for me, or right now, this isn't working for me, that's totally fine. It's a voluntary program. The doors are not locked. We would obviously, with a youth age 10 to 17 years old, call parent or guardian and, make sure the right person comes to pick them up. But if we have a 13-year-old who's saying, I don't want to be here anymore, that's their prerogative and they're welcome to leave. Now, with this program, the other thing that's important to note as I start talking, more about what this provides is that this is one of those programs where if somebody is outside of Oakland County, so if we're sitting here thinking that, man, this sounds like it might be a good fit for, my nephew who's located in Wayne County, if they can get to our front door in Royal Oak, they can come to our program. That's kind of how the Sanctuary works. Another piece about that is the other question that people have is, well, if they're located in Wayne County and you guys are in Royal Oak, what about school? How are they going to get to school every day? Right now, post-COVID, right, the answer is a little easier because they're probably going to have the option to join classes virtually. But pre-COVID, or even right now, depending on the school setup, we also help provide transportation to and from the school, so they aren't missing that kind of academic part of their life. And so just so we make sure we understand, people who come to the Sanctuary and our other programs that I'm going to kind of talk about, they're not missing that aspect, especially because we do find that usually when you pull a youth out of school, they are missing out on like social life, academic life, right? So I just like to make that very clear. Now, what we're doing at the Sanctuary when they're with us is we're working to resolve immediate crises and achieving family reunification or other positive housing alternatives when necessary. So that might mean, I'm having a family crisis that is causing me to want to run away. Every night I just lay in bed and think about running away. And then one night I try to, right? My mom catches me, then when we're here, we provide 24/7 residential care, trauma-focused therapy. We're going to work with individual, group, and family. Let's talk through why this is happening, why the youth is feeling this way, what's going on. We provide expressive art therapy, coordinated case management. We have a substance use prevention life skills group that I actually oversee. And we do aftercare and follow-up services. So after the 3 weeks, obviously we do not expect to be like, great, your family's perfect, all of the issues are gone. That isn't realistic. We know that. So we're going to provide that aftercare and follow-up service. A lot of what that usually tends to be is coming back for more trauma-focused therapy and providing resources in the community. We also, when I say parent guide there at the bottom of the slide, that just kind of means that we don't leave the parent out to like dry, like, okay, we're working with the youth, bye, have a nice day. We also, are there to support the parent. We do a parent intake. We talk with them about what's going on, maybe the troubles that they're facing. And we can also provide resources and support to the parents in some capacity. And the last thing I'll go back to regarding our basic center program is it says 10 beds pre-COVID. Our building, with how it's kind of set up, we've had to limit the number of beds just due to being able to follow social distancing guidelines and all of that. On any normal day pre-COVID, we would have those 10 beds, and right now we're down to a smaller number. So I always recommend with this one and the next program that I'm going to talk about that people call if you think someone might be able to use this, because even if we're full up, we might be able to give you a call back in a week later and say, hey, we have a bed that opened up now. Now, our next program that kind of goes along the same lines as the Basic Center program is our Step Forward program, which is an 18-month transitional living program for youth ages 16 to 17 years old. This is where they're working to develop life skills, achieve educational and employment goals, and transition to self-sufficient living. This is where, if we're talking about, as opposed to our basic center program, that 3-week program, the family is looking at reunifying, the family is looking at coming together again, right? When we're talking about a step forward program, the youth that we're working with in this program usually are having a much higher level of crisis. The family unit might be functionally broken. Part of the reason I use the word broken is because things that are broke can be fixed, right? They can come back together. It doesn't mean it's shattered beyond repair, but maybe I need 18 months rather than 3 weeks in this situation to kind of, make that change happen. And so these youth basically stay with us for that length of time. We have 2 beds for this program. So again, limited space. So if this one were to jump out to anyone as, hey, me or a loved one or someone like that could potentially use this, I would always recommend to just call and see if we have space. And if we don't, hey, can I be put on a waiting list? So when we're talking about this program, it offers a lot of the same things that the basic center program offers, just for a longer period of time. 24/7 residential care, trauma-focused therapy, expressive art therapy, coordinated case management, aftercare and follow-up services. The big change is because they're with us for longer, we can do a lot more of the life skills training there. Budgeting, cooking, job seeking, goal setting, apartment hunting, accessing healthcare. A big example I can think of this is our step forward youth cook dinner for the house 1 day a week. They have a day every week that's their night to cook dinner. So it kind of teaches them how to cook and how to be responsible for that, right? They have to go out and buy the groceries. Sometimes a staff member will go with them, especially when they're starting out, but they kind of learn responsibility. And again, it's that transition to self-sufficient living. It's to give them skills so that when they, get older and they are going to move out, they don't feel completely cast aside. Where do I even start? Now, going along with that, our next program is our graduated apartment program, which is a 24-month transitional housing program. This one is for young people ages 18 to 24, including young parents with minor children. So a 21-year-old with, a 6-month-old child, or a 23-year-old with a 2-year-old, right, could potentially be part of this program for sure. They work to achieve housing stability, maintain employment, and transition to self-sufficiency or alternative housing programs. A lot of what we see with this one is, the minute I turned 18, my parents said, you're not staying in this house anymore, but I didn't have any money. I didn't actually have anywhere to go. And so for a year and a half, I couch surfed, and then I got into, kind of some bad situations, and now I have nowhere to stay. Right. Well, they would probably be able to be considered for our graduated apartment program, where they then stay in their own apartment, a little more self-sufficiency, but they still have, trauma-focused therapy, coordinated case management, that life skills training. So they get that support that oftentimes they aren't getting from a support system in their lives. They usually don't have that built in. And they instead stay in their own place. It is, when it says 22 beds on this slide, that fluctuates, that changes, mainly because we are what is called a scatter site program. We don't have like a building with 20 beds that we own that people stay in. We contract with different apartment buildings. So we might add 2 apartment buildings next month, or we might change, one apartment building might say, okay, you're not going to have our apartments anymore, but then we get 7 more apartments from a different place. So that number fluctuates a lot. But part of the reason I have 22 on this slide is because that's usually around where it is. So we have around that many, just kind of around the county. We have some in Southfield. I believe we have some in Pontiac for sure. We have some around the Royal Oak, Birmingham area. So we also like that scatter site because right now with the group who might be watching this one, you might be thinking, oh, well, then that person would have to move from the Pontiac area over to Royal Oak. Well, potentially not, because we might have an apartment available to them closer to the Pontiac area, and then they can stay close to friends, maybe school, things like that, right? So that's our graduated apartment program. All of these, you would want to contact us, and I'm going to have the numbers at the end and just kind of see if we're a good fit for you. Or whoever you would be suggesting take advantage of these programs. Now we also have outpatient services. These are 90-day and or 12-session counseling services, kind of whichever one you reach first. If in the 90 days you're only able to come to 6, or if you do 12 sessions in 8 weeks, right? Kind of whichever one you come to first. And this is for youth ages 10 to 20. It's available to those who are experiencing a crisis or who are at risk of running away or being homeless. We offer individual and family counseling, and there's no charge and no insurance necessary to be seen. This is one of the ones that I get this question about a lot, because people hear counseling and they immediately think, okay, I'm going to have an insurance card. I'm going to have to show them. No, not for us. And we offer that chance to work through current crises, but we also offer assistance in accessing long-term services. So if you have someone that or you care about who sounds like they kind of fit into this, but you're thinking, oh, but only for 90 days or 12 sessions. Well, the thing is, as you get towards the end of the outpatient services, the counselor is going to say, well, are you still interested in counseling? Let's look and see what other low cost or no insurance needed services are out there, right? Let's see what we can do. So even though it has that limitation on it, the counselor is still going to work to find more services like that for them. And finally, our outpatient services do have a focus on family relationships, emotional health, positive connections, and well-being and resilience. We also have our mentoring program, which is a 12-month community-based mentoring program for youth ages 10 to 17 years old. We provide a healthy, supportive relationship for at-risk youth. Mentors help mentees establish and work toward personal goals. That can be whatever they identify as important to them. It might be academic, it might be extracurricular, it might just be, I want to, monitor my emotional health better. I keep getting into outbursts with my mom. We get into fights every day. Can we work on that? For this one, we offer transportation. So again, if we're thinking, oh, but you guys are based in Royal Oak, then I'm going to have to drive a youth down to Royal Oak every day. No, we actually have agency vehicles that our mentors can drive out to where the youth is, pick them up, and then go do whatever it is the youth kind of wants to do for that community-based program. The mentors are all trained in trauma-informed care, positive youth development, and crisis intervention. We do safety planning. So if the youth is experiencing a mental health crisis of any kind, we can kind of have a safety plan to work through that. And we also provide information to prevent commercial sexual exploitation, better known to most people as human trafficking, and unhealthy relationships. So we talk a lot with the young people about what healthy relationships look like and how to avoid exploitation. And again, as you're probably seeing kind of the common theme, we do referrals and follow-up services, throughout and afterwards. So particularly in the mentoring program, if 3 months into the program, the young person is saying, this is great, I'm getting a lot out of this, but I need more support academically, we might try and find like a low cost tutoring service for them, right? So whatever kind of their need is. For this one, you can contact our resource and crisis line and all that. But if this is kind of the one that you're keyed in on, you're interested in, you want to know more, you can contact mentoring@cghelps.org for more information. And finally, for our youth and family services, we have what I would refer to as my baby, which is the Empower Initiative. That's our outreach and educational services. It's a huge part of my role and is available to the surrounding community. We focus on the empowerment of young people. We provide services that range from educational to interactive modules that cultivate coping skills and strengthen resilience and wellness in the community. We offer engagement with youth via methods such as self-care directives. I've done things with youth as young as 8, 9, or 10, talking about like self-care ABCs. Can we identify, for every letter of the alphabet, a self-care thing that we can do? And M might be meditating, and T might be TikTok. So I can go watch videos on TikTok, whatever it is. That's what I get a lot of. But that's just an example of something really simple. We've done bigger things, school-wide projects. I've worked with several junior highs, high schools, and middle schools to do like school-wide self-care projects, things like that. I do information about common ground services. So obviously this presentation that you're watching is kind of an example of this. We do trainings on topics such as human trafficking, ranging from the basics to resources. We have human trafficking presentations for professionals, adults, and young people. And it's just a connection point to Common Ground Services. If you've never really heard of us before, if this is maybe your first time interacting with us, I really, I have my email at the bottom of the slide, mfreck, mfreck @cghelps.org. You can always reach out to me with questions. I would also totally advise that you reach out to our resource and crisis line that I'm going to have the number on the screen for really soon. But, you kind of have a face that, yeah, I remember May, she presented with the Pontiac Library, I remember her talking about that. So yeah, that's just one other thing. If any of this is interesting to you in a context of, I want more presentations on this to the community or at, a school that I work with, I am here. So now we're going to transition to our mental health services. These are typically what I find that when most people hear about Common Ground, this is usually what they're thinking of, right? This is usually what they're familiar with. So people might be thinking, okay, I kind of already know about these ones. But the other thing that I usually find when I present on our mental health services is that people usually go, oh, I wasn't aware that you did all of that. I thought you did this, but it turns out you also do this, this, and this. So hopefully you kind of listen all the way through and maybe find out about some services that we provide that some people might have been unaware of. So with our mental health services, we provide crisis support. We connect people to needed services. We cover a wide variety of situations. And as it says for number 3, we do not require insurance. I'm going to talk a little bit more about that with specific programs where, again, people kind of expect that they might need insurance, but they don't actually. So, I know, again, a lot of people, that is a huge barrier to service. We talk to a lot of people who go, well, I need these services. I know I need these services, but I can't afford them. So we might be a more affordable option for those people. Now, if anyone is watching, this presentation, especially later on, I just want to say this is the slide that I would recommend taking a picture of, taking a screenshot of, kind of memorizing the information on, because this one, if you forget everything else I present to you about with this presentation, this one can connect you to all of the information again. Because if you remember, man, I saw that presentation and they said something about having a runaway and homeless youth shelter, but I cannot remember all those specifics. You can call our resource and crisis helpline and say, I want that information, and they can share that with you 24/7. So this is also a good one to send to anyone who, didn't make it to this presentation, doesn't have the time to sit down and watch something. This slide can connect them to all of the other information that I'm sharing with you. It's 24/7 phone and chat services. The phone and chats are answered by staff and volunteers who are trained in crisis and suicide intervention. Our training is 96 hours. It's intensive. It takes months to complete, and it's won multiple awards, like national awards, for how well done it is. So the reason I mention that is because I know sometimes people are reticent to call because they're like, I don't know who I'm going to get. I don't know what's going to happen. But we have very high standards for even our volunteers on the crisis line, and they all get that training. And as it also says on this slide, we are Oakland County's crisis line. And here's kind of the thing with that. As it says, we offer intervention in crisis situations. If somebody needs to call for the crisis part of the helpline, it really doesn't matter where they're calling from. If somebody is all the way up here, all the way up to the top, struggling with, depression, anxiety, whatever it is, and they just need to talk about that. They just need to talk about the fact that they are having, a severe mental health crisis. Anyone can call, text, or chat with us. Where the kind of issue, quote unquote, comes in is the second part, that we connect callers with resources in the Oakland County area. So if somebody is calling from Lapeer County, we can talk them through, if they're having a panic attack, but we might not know all of the resources in Lapeer County. We would still try and help them and figure things out, but we're never going to know as much about the resources in another county because we're based in Oakland, right? So what I usually say about this is, if somebody literally just wants to call and talk through something, and they're comfortable calling us for whatever reason, or they're only able to get a hold of us, they can certainly call us. We would never hang up the phone on them. But if somebody is literally just calling to say, hey, I'm in Lapeer County and I need resources, I'm kind of doing fine, but like, I just need some resources, we might kind of try and find another number for them to call. Usually what I kind of recommend for Michigan specifically is that you can actually call 211, literally just the number 211, and you can get statewide resources. Or you can Google your county and crisis line and see if your county has one. A lot of counties do. It depends on population. Like I believe up in the UP, for example, they have a smaller number of crisis lines. So each county doesn't have one because the population up there is so low. But usually if you kind of Google to see, most places, even around the country, like nationwide, have some kind of crisis line for the area that you're in that you can reach out to. And then I really want to emphasize that we have the ability to connect via chat or text based on individual preference. So this might be as simple as, we talk to tons of young people who that's just how they prefer to communicate. They prefer not to talk on the phone and they prefer to text or chat with us. We also talk to people who it's a safety issue. They're in a domestic violence situation and they're like, well, I text you or I chat with you so that nobody can overhear my conversation, right? And then we also have people who say, I'm really no good at texting or chatting. I like to talk. I'm a talker. So they call us. So it's all individual preference. Now, as the slide says, the helpline can be reached by calling or texting 1-800-231-1127 or chatting on commongroundhelps.org. This information will be up again on the last slide of this presentation. But again, I just want to emphasize, if you remember one thing from this presentation, it's this slide. This slide is kind of the key. If you forget everything else, they can remind you about it. Now, the next thing that we do is what we call walk-in assessments and interventions. This is face-to-face assessment, crisis intervention, and stabilization services to individuals, including children. These services are available 24 hours a day, 7 days a week. And we offer a focus on problem solving and assertive crisis resolution strategies tailored to each person's specific needs and service without the need for insurance. Now, what I would say even more than service without the need for insurance is that this kind of service is really best suited for people without insurance. If somebody has insurance, I'm really going to kind of suggest that they maybe go to an ER if they're having a mental health crisis that they think might necessitate hospitalization. Not because we wouldn't take them, but because we're still going to bill them. We still have to if they have insurance. But if they don't have insurance, we don't have to bill them and we won't. So then it becomes a free service. And that's really a lot of what it was built for. And so we call that internally the Oakland Assessment Crisis Intervention Services, OASIS, OACIS. And again, that's available 24 hours a day, 7 days a week. And people come in usually when they have a high up here crisis situation. It's something that we might otherwise think of as somebody needing to go to the ER because they are intensely, facing that mental health situation. But yeah, I really, really talk about this one in terms of it's great for people who don't have insurance and are, again, we have that person who's saying, I would love to go get services. I'm really experiencing a crisis, but I'm scared of that hospital bill. They can come to us, right? Now, going alongside with that, we have what is called our crisis residential unit. And that's a short-term 1 to 14-day voluntary alternative to inpatient psychiatric hospitalization. And we say 1 to 14 day because, again, it's voluntary. So if somebody after half of a day or 1 day goes, I don't want to stay here, I think I'm ready to go home, they're more than welcome to. It's a trauma-informed, recovery-focused treatment environment, and admittance requires prior authorization through OASIS, Oakland Assessment Crisis Intervention Services, the program I mentioned on the slide before this one. They have to go through that to get to the CRU. It offers psychiatric medication review, group therapy and skill groups, recovery coaching, art therapy, coordinated discharge planning. We actually have a professional chef on staff who is there a couple of days a week to work with the patients on like cooking skills, things like that. A lot of people who come to the CRU, I don't know what it is, but that is like a huge highlight for them, probably because food is awesome, I guess. But the biggest feedback that I get from the crisis residential unit, like I just got this the other day, is they're always like, I wish all inpatient psychiatric, programs were like this. So I hear people saying who have been to this and to other types of this type of program saying, man, I wish they were all like the crisis residential unit. I wish everything was like that, which is very nice to hear. It makes me feel like we're doing something right with this program and that people feel, I think the big feedback I get for this and for a lot of our other programs is that none of it feels like people are locked up. None of it feels like people are in like a prison or something like that. People feel like, hey, I can leave when I want to, which actually in the long term makes a lot of them more likely to stay longer, right? Because they know it's their choice. Next, we have our mobile crisis team. They come to you to provide services once they've received a referral. So, this is something that would be from a hospital, a psychiatrist, a doctor. And it's available in both Oakland and Genesee County. So this is one of our programs that's, again, a little bit of a exception where, I do feel that I forgot to say that with things like crisis residential unit and walk-in assessment and intervention, just to be very clear, with those two, those are Oakland County based, and we can only take Oakland County residents for those ones. So just to be very clear about that. But with mobile crisis team, that's available in both Oakland and Genesee County. So if somebody is located in Genesee County, they can also get referred to this program. It's also regardless of income or insurance. So again, oftentimes when people think about these types of mental health services, they imagine, okay, so I'm going to get like a bill for thousands of dollars in the mail. But with mobile crisis team and with the two previous services I mentioned, that is not a situation people need to worry about, particularly if they do not have insurance or if they're underinsured or low income. That isn't how that functions. And we offer outpatient support for up to a month until the person is connected to a core provider. So usually how this functions is that, somebody might have gone into the hospital for a mental health crisis evaluation, and the hospital might say, you don't need hospitalization, but we are going to refer you to services. And they might get referred to a couple different services that say we have a wait list of a couple of weeks. But that person might be sitting there thinking, but I still have a mental health crisis. I'm still struggling, right? And so the hospital might say, well, we're also going to refer you to the mobile crisis team. And so while you're waiting those 2 or 3 weeks on the wait list to get connected to outpatient services, the mobile crisis team is going to work with you, kind of evaluate what you need, and be outpatient support until you get connected to that core provider. It kind of gives, as the last point on this slide says, a clear plan in a person's journey forward. We're going to find, as I talk about this one in another program coming up, that often what happens is when people don't get taken in for hospitalization, they tend not to end up in outpatient services later on because they don't have continual support through that process. And so the mobile crisis team is one of our programs that is meant to provide kind of a fill in for that gap between when I go to the hospital or I go to my psychiatrist and I'm waiting for that outpatient, service for my crisis. We're kind of filling in that gap there. We also have our victims assistance program. This is 24-hour access to counselors and advocates for victims of crime, domestic and sexual abuse, workplace violence, human trafficking. This is for people of all ages. So if we have a 15-year-old who was a victim of a crime, they could be in our victims assistance program. We offer on-site advocacy, personal protection order assistance. We accompany victims to hospitals, police stations, courtrooms, medical screenings, etc. Anything that like is pertaining to their experience as a victim of a crime, that they might feel unsafe going to alone, that they need support at. They get this intensive case management that works with them. And they just kind of work through all of that together. So a lot of times when we're thinking about someone who's a victim of the things that I listed, they might not even feel comfortable starting the process by themselves. And they could reach out to our victims assistance program and get that started with someone who can advocate for them and support them. Now, something else that's important to note about the victims assistance program in terms of who can use it based on where they're located is that how it works is either the person has to have been a victim of a crime in Oakland County, or they need to live in Oakland County while they're using the services. So for example, if we have someone who's living in Wayne County right now, and they were a victim of a crime in Oakland County, they could use our victims assistance program. Or if we have someone who's living in Oakland County right now and was a victim of a crime in Wayne County, they could use our victims assistance program. It's kind of how that works. And again, with victims assistance program in particular, if you have someone who you think might be able to use this type of program but doesn't fall into those parameters I just explained, by all means, reach out to 211, reach out to another local crisis line for your county or area and say, hey, I heard about this type of program. I don't think I qualify for Common Grounds. Is there something like that in my area? Because these types of services do exist in a lot of other counties and areas. We also have our legal clinic, which is a weekly legal clinic staffed by volunteer attorneys. We offer free legal advice, help with a wide array of legal issues, and emotional support. Now, the one thing I will say about the legal clinic that I used to never have to say, this is a post-COVID thing, is for exact times and days, call our resource and crisis line. It used to be weekly in the same exact location every week. There was 2 different locations that it operated out of, but it's been changing a lot due to COVID and due to building restrictions of how many people can be in certain, spaces. So if the legal clinic is something that sounds interesting to you, if you're thinking that sounds like something I could use, or someone I care about could use, please, by all means, call our resource and crisis line and see where they're kind of going to be at, or if they're not going to be open for, a week because of COVID restrictions, see if they have other resources for you along the lines of that. Next is our sober support unit. Like I mentioned before, I was going to talk about another service that kind of fills a gap, and the sober support unit is that service. So it's designed to monitor individuals who need detoxification services and have no health risks associated with the withdrawal process. It's a voluntary program, and usually where we see people using this one is somebody goes into the hospital because they're experiencing a mental health crisis. When the doctors or the staff start talking to them, they realize this person is using drugs or drinking alcohol. They're drunk or high at the time of being there trying to access services. Now, what the problem that comes in for them is when somebody is using drugs, when somebody's drinking, they can't tell which of the, if somebody's experiencing hallucinations, let's use that example, they might not be able to tell if those hallucinations are the mental health crisis or if they are the substance use, right? And so the staff at the hospital is going to be like, you actually have to leave until you are not intoxicated anymore and then come back. Now, what usually ends up happening with this is the person leaves, they sober up, and they go, I don't want to go to the hospital. I don't want services anymore. I decided I wanted them while I was intoxicated, but now I don't want them. I feel fine. And sometimes it can become a vicious cycle because sometimes the only time that person is ready to admit that they need support is when they are intoxicated. So we see that issue come up a lot. And so the sober support unit is actually pretty unique. It's one of those services I mentioned that quite frankly doesn't exist in most other counties and even other states. So we're kind of the only ones that provide that, which is I'm hoping that more places see how well this is working because we've had a lot of success with it. Because what then ends up happening when they can stay with us in the sober support unit and get detoxification services with peer support throughout. Usually then at the end of it, once they've sobered up, they are then, okay, let's go. They're ready. They've kept that support throughout. There isn't that gap, and they end up going to get mental health services in the end. Again, part of that is it's a voluntary program. Nobody is forced to be there. They know they can leave at any time that they want to, but they usually end up staying longer because they know that. This is also a 24/7 service, and it's service regardless of a lack of insurance. So with this one, doesn't matter if they have insurance, doesn't matter if they're underinsured, doesn't matter if they have no insurance at all. They can come to us for this one. So that is our sober support unit. Now, we also have a mixture of support groups led by Common Ground staff. We offer survivors of suicide loss for those who have lost a loved one to suicide, survivors of homicide for those who have lost a loved one to homicide or drunk driving. Growth and healing is for young women who are survivors of sexual assault and or abuse. And domestic violence survivors is for women 18 plus, kind of exactly what it sounds like for women who are survivors of domestic violence. And for any of those, you can, if you want information about specific groups, sorry about that, including meeting dates and times, you can call 1-800-231-1127. Again, that's our resource and crisis line, and ask about it. Mostly because right now, again, we used to have like regular days and times for those, but it's kind of been changing around because it's virtual due to COVID. One that I didn't mention that I know is on the slide, if anybody is looking, is that we also have our love and logic parenting classes. I kind of separate those out a little bit just because they're a little different from a regular support group. They're for parents of teenaged or like preteen young people. And they're more like classes rather than support groups, although sometimes they function a little like a support group because, you know, there might be a little debriefing session of, oh my gosh, I can't believe this is going on with my, you know, my child, and everyone else might be like, yup, I'm experiencing that too, right? So it kind of functions a bit like a support group at the same time as being an educational class. It's really great for anyone that you know in your life or yourself who maybe feels like you're at a loss of how to parent your child, just struggling with some of the things that are coming up and you don't really know who to turn to. You kind of want a group of people who might get it and understand. And quite frankly, with these classes, I am not a parent myself, so I'm going to kind of use blurbs from coworkers. I've had multiple coworkers who are parents of preteens and teenagers say, they're like, I went to those parenting classes and I took them and I got a lot out of them. So, you know, they are classes that some of our own staff have gone to and found great, you know, outcomes from it and felt like they learned a lot. So it's great for like a mixture of people. People can be at any level of struggling with kind of that parenting. And yeah, and all of these support groups, including classes, again, these are free. And you do not have to be referred to any of these ones. You would just call and see when the meeting dates are and if you're interested. Now, we also have volunteer opportunities. A lot of times I'm presenting this to people who are looking for volunteer opportunities for young people. So the first sentence I have on here is the main way for young people to volunteer with us is at age 17 on the crisis line. But that's true for anyone, people like around 17 and up, all the way up to, you know, elderly people can very, very much come and volunteer on the crisis line. We have a lot of retired people who volunteer. We have a lot of college students who volunteer. We have a lot of people in the middle. So it's a big mix. Whoever's kind of 17 and up, if they're interested, you know, come on down, basically. Again, it is an intensive process. It isn't just, I want to volunteer on the crisis line. Okay, sit down and pick up the phone. Because to be on the crisis line, you need to pass a screening interview and then go through 96 hours of training, including training on applied suicide intervention skills. And part of that is because people who call our crisis line, sometimes they call and they're just like, I'm totally fine, but I need, you know, help paying my water bill. And you might give them that. And sometimes they call and they're all the way up at the top and they are, you know, they're in the middle of a panic attack, right? So you need to be able to pick up the phone and handle either of those situations, right? Now, speaking as someone who started at Common Ground as a volunteer, they do a great job of preparing you. They're awesome at it. You really feel like you got the training that you needed and you're ready to pick up the phone. And the first couple of weeks of picking up the phone for the crisis line, your supervisor will actually be on the phone with you and kind of just like a backup person listening, ready to pick up the phone and help you because you're new, you know, and we don't want to expect people who are brand new to be ready for every single situation, right? It's still kind of a training process. And then because I work with the Runaway and Homeless Youth Services in Royal Oak, I just like to mention we're always taking donations. We take toiletries, household items, art supplies like sketchbooks, acrylic paint, knitting needles, micron pens, gel pens, and gift cards for just like, you know, things out in the community and things like that. And you could always reach out to me, call the sanctuary, which I'm gonna put up the slide with our contact information in a moment. And you could always reach out to us in general for any kind of, you know, hey, I was looking to donate, you know, anything like that. So just for anyone looking more for that, from that volunteer lens or that donation lens, you know, we are in the community and we appreciate the support very much. And finally, I have this slide, as I've mentioned a couple times throughout, that I have our, you know, contacts on there. And it has our, oh, I see someone in the chat said previously I've referred parents of youth to the Youth Mobile Crisis Team. Yes, Youth Mobile Crisis Team is awesome. I'm not sure where, that's from Paula Johnson. I'm not sure where you're working that you're referring people to the Youth Mobile Crisis Team out of Southfield. Awesome. But yeah, it's important to note that the Mobile Crisis Team, we work with youth as well. I forgot to mention that. So awesome that you mentioned it, that yeah, that service is available to youth. It's not just for adults, because young people need support with their mental health care as well. So it's awesome to hear that you sent them our way. So for our, let me start, sorry about that. Let me start sharing that again. For our contact, we have our Common Ground Resource and Crisis Helpline again, that can be called, can be texted at 1-800-231-1127. Or you can chat from our website, which is commongroundhelps.org. Honestly, also, I always tell people if you just Google Common Ground, you know, Common Ground, Oakland County, what will come up and people can find us that way if that's easier. Our Common Ground Resource and Crisis Center, that is where like stuff like Sober Support Unit, Oasis, the Crisis Residential Unit is actually located physically. That's where people would come to if they were going to drop someone off for that. And that's at 1200 North Telegraph, Pontiac, Michigan. Believe me, we get plenty of calls on the Resource and Crisis Helpline of, I cannot find your building, where is it? So never hesitate to just call the number if you're just trying to find where we are. And then Common Ground Youth and Family Services, the Runaway and Homeless Youth Shelter, that is located at 751 Hendry Boulevard, Royal Oak, Michigan. And if you wanted to call about any of those programs, more specifically, if you know that's what you're trying to reach, you would call that number at 248-547-2260. And again, you can either say, I know specifically what program I want, or I remember I saw a presentation and it was something like this. Do you have that? And we'll kind of figure out where you're trying to get to. So that is my last slide. I'm not sure if anyone had any questions. I know we're kind of right now, I ended a little earlier than expected, but I wasn't sure if anybody had any questions, thoughts, comments, concerns. Not only can they be, you know, dropped in right now, but, you know, if someone is in a month or so watching this, if someone is having a question and isn't comfortable asking it right now, where it's, you know, on a presentation, that Common Ground Resource and Crisis Helpline, I always like to emphasize it's the resource and crisis helpline, right? People can call us when they're in crisis, and absolutely do, but you can also always call us with questions or clarification about programs. So anybody who's a professional, it sounds like Paula is in the audience, you know, professionals call us. I'm a teacher from a school, I'm a counselor, I'm looking to refer someone to a program, and I just want to understand how's that going to work. You're more than welcome to do that. So I know right now I am not seeing any questions in the chat. I'm not sure if there was anything on Facebook or anything like that.
I'm not seeing anything on our Facebook page.
Okay, that's all right. That's okay, no problem. I know sometimes people are like, I'm gonna save my question for calling or, something like that, and that's fine.
May, that was incredible.
Thank you.
That is really, that's a lot of stuff there. And
Yeah.
it's amazing, yeah. So
Yeah, and that's why I usually do find that when people think, oh yeah, I've heard of Common Ground, I've heard of the programs you offer, usually there's at least one thing on that presentation that makes them go, oh, but I didn't know about that one.